Currently, more than 55 million people have dementia worldwide. This number is expected to rise to 139 million in 2050. Alzheimer's disease is the most common form of dementia and may contribute to 60 to 70% of cases. Alzheimer's disease is a progressive brain disorder that damages brain cells and connections. It gradually steals a person's memory and thinking abilities. Alzheimer's disrupts brain functions by causing abnormal proteins, called amyloid, to build up. These buildups form plaques that act like tiny roadblocks, disrupting communication between brain cells, leading to memory loss, confusion, and eventually a decline in daily activities. Donanemab is a monoclonal antibody targeting the amyloid plaques in Alzheimer. It binds to amyloid proteins before it forms plaques. Donanemab also binds to amyloid plaques that have formed. These antibodies trigger immune cells to clear amyloid plaques from the brain. Unlike currently available treatments, which can only relieve symptoms, donanemab is a so-called disease-modifying treatment designed to tackle the underlying pathology. A large international clinical trial, called TRAILBLAZER-ALZ 2, investigated whether donanemab could slow disease progression and if it was safe. Over 1,700 participants with early Alzheimer's received either donanemab or a placebo, administered intravenously every 4 weeks for up to 72 weeks. The treatment duration for each participant depended on amyloid plaque level detected on their brain scans. They continued taking donanemab until a specific level of amyloid was cleared from their brains. Once this occurred, they switched to the placebo for the remainder of the study. Participants were tested against several measures of memory and thinking. The primary outcome was the change in Integrated Alzheimer Disease Rating Scale, or IADRS score from baseline to 76 weeks. The IARDS has score range of 0 to 144 points, with a lower score indicating greater impairment. The results were encouraging, particularly for those in the early stages of Alzheimer's disease. Donanemab slowed cognitive decline by around 35% compared to placebo in participants with low to medium levels of another protein, known as Tsao. This means less difficulty in performing daily activities such as managing finances, driving, and carrying out hobbies. In this low to medium Tau population, donanemab lowers the risk of disease progression to the next stage by 39%. Additionally, nearly half of study participants on donanemab showed no disease progression after a year, compared to 29% on placebo. As of July 2024, donanemab is still under review by the U.S. Food and Drug Administration. While more research is needed, it offers a potential path to improve the lives of patients. There are potential side effects, like brain swelling, that need to be carefully monitored. Regardless, donanemab represents a beacon of hope in the fight against Alzheimer's. It's important to manage expectations. Donanemab is not a cure. It doesn't reverse the damage already done. But slowing down the progression could be a game changer for patients. And that's it for today's pharmacology video. If you enjoyed this video, please give it a thumbs up and subscribe to the channel for more pharmacology content.